The Foundation for Special Surgery aims to provide highly complex surgical care in communities worldwide where the need is great, but the expertise is lacking. The Foundation has worked in countries like Peru, Bangladesh, Vietnam, Ethiopia, Ghana, and Cameroon. For more insight, I am joined by Pamela Sofola, Director of Development for the Foundation for Special Surgery. Pamela, welcome to the show.
Thank you. Thank you, Linord.
So access to safe surgery is a challenge in Africa. We see it in reports. So it is being addressed by the Foundation for Special Surgery. First of all, how much of a problem is it? What is really being experienced by people on the ground?
Yes. The Foundation, what we're finding is there's lack of capacity, there's lack of infrastructure, there's lack of expertise because there's lack of infrastructure. We can't train the people with the correct equipment. And then also we're dealing with the state-of-the-art equipment, as I was saying. So basically it is lack of capacity, lack of expertise, and state-of-art equipment.
So when we look at some of the most pressing needs, for example, when you think about people in the rural area, if in the cities you talking about these issues, what about access for these people in the rural area?
Exactly. It's really hard, but Foundation for Special Surgery, we have been going to countries now for over 15 years, and we are providing healthcare to people that come from the villages. They come to the city, and we give them the exact care that we actually give here in America. So we have really specialized surgeons. We deal with children that have cleft palates, children that have deformities because of cancer. You know, here, if you have a little spot that grows on your cheek, for example, you get it taken care of right away. But in Africa, that tumor can really grow. And so, you know, we just want to provide the kind of healthcare that we provide here in America as well as in Africa.
That's a big challenge because it's such an advanced medical system here, right?
Right.
So what does it take? What kind of impact have you seen through your work?
Yes, so like I said, we have been going for about 15 years now, back and forth, right? Training the surgeons on the ground. But we have realized we cannot just be going in and out. We need to build capacity on the ground. And how are we doing that? We're actually building a hospital in Ghana. We're just so excited. The last time I was here, I think 2018, I told you that our plans were to build a hospital. Well, we broke ground last year, April 24th, and I am pleased to say that the building is almost 95% complete. And we're hoping to open up in first quarter of next year.
That's amazing. That's amazing. So how will people have access to this hospital? What should they look forward to in this state-of-the-art facility?
They will have, like I said, direct access to the hospital. We're going to be giving free surgery as well as paying. We're still going to do pro bono services, but also there will be paid services as well. But the key is that it is going to be a state-of-the-art facility, a 40-bed hospital, and I'm talking about 40-bed private rooms. Usually in Africa you have a huge ward. This is going to be private rooms, and the care that they will get is the kind of care that they get here. You know, we'll have doctors from institutions here, from Hopkins, from Harvard, training people on the ground so that they can in turn train the next generation of young surgeons.
That's amazing, because then people will not have to travel.
They will not have to travel. You can imagine what happened during the pandemic. People that normally could travel out, they could not travel out. They had to stay in the country, and guess what? Healthcare, where was the healthcare? So a lot of people died.
That's true. And something I want to touch on before we wrap is your gala. You have an annual gala.
Yes, we have a gala coming up this Saturday.
Actually, that was a platform to help build the hospital.
So
very quickly, what's on?
So we have the gala this Saturday at the Mayflower Hotel. It's at 6 o'clock, and we're going to be showcasing some of the lives that we have touched and saved. They're going to be stories of people that, you know, they're here to tell their story. And then also we are going to showcase the hospital And of course, we're fundraising to now equip the hospital, because the building, like I said, is about 95% done, and we're raising funds now to get equipment in the hospital.
Well, that's very exciting. I was able to see some of the work, and I see those surgeries. I mean, one woman that didn't have a face.
She did not have a
so
face.
We have to leave it there. So good luck and all the best with the gala, Pamela.
Thank you so much.